Guys, we're excited to talk about a topic that I think is very relevant to literally everyone, which is mobility. But we're going to really dispel a lot of misconceptions, hopefully give you guys a better track of both understanding and how to apply mobility training both to yourself and your clients. So first off, we do have to thank Perform Better, Aaron, Chris, and the entire team. I mean, to be giving us this type of opportunity to share with you guys education, better solutions is really phenomenal. And we don't get to do this without their support. So again, I hope you guys take an opportunity both to thank them and support Perform Better whenever you have the chance. Also, thank you guys too. This is our 4th webinar. I know you guys are taking a significant portion of your day out to listen to us, and hopefully we can return that with great ideas and solutions for you in your training. We also, because of our 4th webinar, have to thank our dogs. Anyone who has boxers knows they can be crazy, and so far they've been good, knock on wood. So we're going to hope that this webinar holds true as well. So we have to thank them for not screwing up this entire webinar series as we've been going through it.
All right. Thanks, guys, for being here. Thought this was appropriate to start off this presentation. This is Alan Cosgrove out of Results Fitness. Really that last portion, not demonstration. Training is about adaptation, not demonstration. And a lot of what we see when it comes to mobility is one's demonstration of mobility. So it can be frustrating oftentimes when you see things like this. It's more of a demonstration of mobility. In fact, this is typically used as a screen for thoracic mobility. You're going to see a video later on from FMS kind of going through this. This is also a demonstration of mobility. It requires a lot of mobility and stability at that core to perform movements like this. So this is more of a demonstration of mobility. This one is often really popular as well, getting people into some awkward positions and going through some mobility drills like this. But this is really more of a demonstration of mobility. And for those of you that actually have done this, it's not that comfortable. It's actually quite challenging, and it's difficult to get people in these positions. So if we're talking about joint mobility, we have to first really define what joint mobility is. And it's really the uninhibited range of motion occurring at a joint. And there's lots of things that inhibit joint range of motion. We have muscles, tendons, ligaments. We've got the joints above and below those areas. We've got posture. We have all of these things that can affect mobility. And oftentimes I just see people trying to zero in on that joint and really crank into that range of motion. And we forget that there's a lot more involved when it comes to mobility. And I really like this. This is Lee Burton. He's talking about at the joint or series of joint and the ease at which those joints can actively move through that range of motion. The ease of that motion is really important as well. Just because someone can get full range of motion doesn't mean that they're not having pain or discomfort or that it doesn't take a lot of effort. So we also have to take that into account when we're talking about mobility. Does it hurt to move through that range of motion? Is it easy to get there? So we're talking about that uninhibited joint motion. And this is taken from Dr. Brandon Moncello's screens. I don't know if I said his name right.
Well,
We'll have to ask him later on. But really looking at all of the things that can impact mobility. We've got joint mobility dysfunction. So we've got that capsule. So these are the things when you hear about those adhesive capsulitises and things like that, foreign body, dislocation, bursa. So we're talking about the bursitis, the tendinitis, the itises, all of those inflammatory responses, degenerative joint disease that can actually change the structure of the joint. We've got tissue extensibility dysfunction. So that's where you start to see the spasms and the protective guarding. And that's why just stretching a joint or forcing a joint into certain ranges of motion in the hopes of improving mobility often isn't going to get you the results that you want. Now, I put this up here because inevitably, whenever I show, I'll use air quotes, a joint mobilization exercise on Instagram or social media, I will get clinicians, young PTs are yelling at me saying, you know what, that's not a true joint mobilization. In actuality, joint mobilization is really just to restore optimal joint function. So it can mean a lot of different things, but I wanted you guys to see in the clinical setting, joint mobilization is really a manual skill. It's done passively, and there's a lot of technique behind it. So yes, we can interchange some of these terminologies, but I want you to understand joint mobilization, we're just really trying to restore joint movement. And when you hear mobilization versus manipulation, those are also used interchangeably as well. But manipulation is a little bit more high force, high velocity. something that you see in chiropractic adjustments. So I really wanted you guys just to kind of have an understanding in the clinical aspect, what it means to do manipulations and mobilizations. And I'm not going to go through all of this here. I just really wanted you to have an appreciation for those clinicians that do passive manual therapy for joint mobilization. Today, we're going to be showing you a lot of things that you can do through exercise and movement to improve joint mobility.
Yeah. So, I mean, I think that was important to distinguish because, again, like Jessica said, we're looking more through the exercise component. So I think there's a lot of confusion now when we talk about joint mobility in reference to when someone comes into your gym, even it can be in a clinic, and they're not demonstrating great mobility. I think a classic example is the low back, right? So a lot of people may have low back pain and you look at their mobility of their spine and their spine is really limited. And I think people immediately go to, well, they need more mobility, so let's train mobility without realizing what the problem may actually be. So research has shown over and over and over again that really flexibility and mobility of the spine is not a typical issue when you're talking about low back pain. Now that's confusing when I just said that a lot of people with low back pain are not going to probably demonstrate good mobility of their spine. But as Jessica mentioned before, there's a whole different arena of spasming, guarding that happens. That's all neurological that may make it appear as though someone doesn't have good mobility. But there is a profound difference. Is the nervous system protecting our body, or does that joint actually lack mobility? And the same thing can be said about stretching the hamstrings. You know, when you have low back pain, I remember when I was 14, I at first was diagnosed, I had herniated discs that were causing me significant problems in my disease that, physical therapists were telling me to stretch my hamstrings because my hamstrings were very, very tight. But they didn't think about it in the context as a protective mechanism. So my hamstrings were probably tight as both a reaction to the nerve impingement that I was getting, but also potentially as a protective mechanism. So what Dr. McGill points out is a lot of times people might feel good at stretching right at that moment, but it causes a stretch reflex that can cause problems later on where that person actually exhibits and experiences higher levels of pain. So again, we have to understand what exactly is going on if we're going to provide the appropriate solutions. So we presented this during our low back presentation, but I thought it was worth revisiting since the topic's mobility. So if you guys can see the graph on the right, I know it's a little hard here, but the area in gray are people with no low back pain. The people in black have low back pain. And this is of the lumbar segments from L1 to S1. And what they found was that people with low back pain had more movement, more mobility of those vertebral segments than people without pain, which makes sense if you understand low back pain because a lot of mechanical low back pain stems from instability of the joint. So we can't control the movement of the joint. They get too much movement. And that's why fusions, for example, are a very common surgical intervention if other things don't work, that you have to stabilize the area. And then obviously, then we reduce movement. But if you take someone who has a painful back and try to get them more mobility, you can see you could actually be making them much worse because they already have too much mobility. So what we wanted to help you guys do is first just understand the difference between a couple of key concepts. So there's active and passive types of mobilities. Jessica sort of mentioned some of those already. So active is I'm moving myself through a range of motion. And the big difference here is that my nervous system has to coordinate everything in my body and navigate. Do I have pain? Does something not work? In order to produce a movement. That's going to be very different than passive, as Jessica mentioned, and what you see Jessica sort of stretching my hamstring here, where she's moving me through a range of motion. So there's a big difference because during the passive, my nervous system is not really interfering with what's happening with my body. So if I want to know, is this more of a structural issue or is this more nervous system protection? If I see that I'm really restricted in my active mobility, but I have more mobility when I'm passive and someone's moving me through it, chances are I don't have a structural issue. I have a nervous system that's trying to protect my body from something. So I thought a really good example of this, FMS put out a really good video. Michelle here is going to give you guys a practical example. I'm going to make sure the volume is appropriate. And so you guys can see this in real life.
So what people case your other, this multi-segmental extension, setting good is short extension. Now reach forward to fingertips the crystal skills. So we noticed he cleared our landmarks are criteria, but what really pops out to me is this non-needle curve, which really has me start thinking that maybe this is a sense rotation mobility dysfunction. But remember, I'm not going to start treatment on it. I'm going to make sure that I prove that that actually is the case. So make here's a tip for me. If you don't all fours, and you're going to go against your butt towards your heels, and bring those forearms together for me. So in the answer for me, this ability to sort lumbar lock checks. We're looking at the lumbar spine, and we're really just seeing does the thorn the ability to extend it and rotate. So now go ahead and put that right hand on the small of your back for me. So right here, I'm going to go ahead and turn his head and chest to the right for me as far as he can. And we're looking for 50 degrees as long as that seat is not quite pushing. I'm still going up my answer yet. My next step is to see look possibly warm up. When I come in here, I can possibly take him to 50 degrees. Guess what's that? No, this is not the extension, rotation, mobility function. It's me. He emotion. He doesn't have the ability to control.
That's going to be a theme that you guys hear a lot, because that tends to be the case more times than not with the clients that most of you are dealing with. Just in a clinical setting, may have to take into account other things, especially post-surgical patients, but generally in a fitness environment or even a post-rehab environment, these tend to be the issues that you're really addressing. So again, if that individual was sitting there and just cranking, doing thoracic mobility exercise, he'd get nowhere because it's a neurological issue. It's not really a structural one. So Brandon here is going to also address, this in a different way, just so we can really make sure, because this is probably the most important thing for coaches to understand, because on social media it is very clear that coaches do not understand this concept that leads us down to not providing the best solution for clients.
Okay. Shooting abilities.
Uh-oh.
So for instance, if this is my normal health.
Well, that video is not working for some reason, so I'll explain what Brandon was going to talk about. So if I go ahead and bring my shoulder up, well, let's say Jessica tells me to bring my shoulder up, my shoulder gets stuck here. As far as I can bring my shoulder up, then Jessica comes up and moves my shoulder, but my shoulder can go way back here. That means I actually do have the structural mobility, but my nervous system is saying, something feels unsafe. For one reason or another. I don't know where that's coming from yet. My nervous system is going, I don't think so. That range of motion is not safe for you to go into. So therefore, the nervous system is putting on the brakes. So it's not an issue with the joint. It's not an issue even necessarily with the connective tissue or the muscles. There's something in the nervous system that I don't know yet is protecting me from, and then we need to investigate further, and we'll go through some ways of doing so. So this is a great quote that Gray Cook puts out all the time, that stiffness hides a stability problem and causes a mobility problem. And for those of you that have heard FMS in the past, you may be a little confused, and I understand we'll go into why, because oftentimes Gray and Lee will say you need to have mobility before stability. And having talked to Gray and Lee in detail about this, I can tell you what they really mean is you need to have the capacity to get to those ranges of motion. You need to figure out how you get into those appropriate ranges of motion. And the solution might be providing more stability in various forms. We'll cover some options, obviously, through this presentation, but that's what they mean. Before you do a lot of other training, you have to be able to access that mobility, but the answer may be through some stability.
All right. So when we're talking about joint mobility, we need to ask ourselves, are we even measuring mobility? Every joint has a normal range of motion. Here you're seeing range of motion at the hip. And oftentimes I see people just dishing out mobility drills, mobility exercises. And I have to ask, are you even seeing if it's appropriate? Do they even need these mobility drills? Are you screening? Are you doing your assessments to see if this is even needed? And oftentimes I'm not seeing people go through some of these screens to see if mobility is even an issue with individuals. And we have to understand too, normal range of motion is going to be different for a lot of different individuals. So someone like grandma in her 80s might not be able to get her shoulder full flexion or that 180 degrees. It may not be ever possible to get her there. So we have to understand that there's certain normal ranges of motion for individuals, and we can't expect them to get that full range of motion all the time.
And I think everyone wants to focus on the extreme end rather than understanding that there's a range. So as long as you fall in with that range, you're generally seen as having good mobility. So again, I think that's something that you're hitting on, just that, are you screening where do they fall within that range? And is that acceptable for what we're seeing with some of their other health issues that we have to take into consideration?
Exactly. So I wanted to show you guys an easy to do hip internal and external screen. You might have seen this before, but I'm going to break it down in this video for you. Like, one of the easiest screens to do to look at hip internal and external rotation is a simple shin box position. Getting your client set up in this position, we're looking at hip internal rotation here on the left and hip external rotation on the right. We want to make sure that they can assume this position. Oftentimes, this can be rather challenging for individuals to even get in this position if they lack the mobility. So just being able to sit upright, have a nice neutral spine, and obtain this position is telling me that we have pretty good internal and external rotation. But what we want to really see is there differences side to side as well, because we know that those asymmetries can really set people up for dysfunctional movement patterns, injury, and even pain. So again, we're looking side to side, making sure that that individual can sit comfortably in these positions. So the shin box position is actually a difficult position for individuals that are lacking hip mobility to get into. Like I said, it can be challenging to even sit upright in that position. So it can be hard to utilize that position. But what people don't understand is that you can play with ranges of motion. This video here, I'm starting from the top and working through whatever range that I can get through into that shin box position. I'm utilizing some PNF or diagonal patterns to initiate some core stability, which we're going to touch on in a minute. And you can see over here, we can just stay at that top position of the shin box. And again, we're using the around the world to focus on that core stability as well, while we're still targeting some hip mobility. Now, position matters. I mentioned this briefly, but position really matters when you're looking at hip mobility. You can see here in the video, if I have a nice open pack position of that hip, you can see that range of motion looks pretty good. But if I close it off or go into other different positions that I showed earlier, that hip mobility is going to look like it's not good at all. So we have to be aware of positions and postures when we're really looking at mobility at a joint. This is just an easy screen. Oh, it's so good. Josh said this wasn't possible to have issues with clicking that. All right, this is an easy to do screen for hip internal rotation. And again, it's always important to make sure that you're looking side to side, because it's those asymmetries that is going to set you up for dysfunctional movement paths. But I really just wanted to give you easy screens to do. The importance of screens is to see if we need to address some mobility stability issues. Again, we can recheck because we want to see if what we're doing is actually working. So these are set up to be really easy to recheck. Obviously, if you're a clinician, you can go through your assessments and do your measurements. These are just easy to do screens. Now, when it comes to the shoulder, we've got normal ranges of motion for the shoulder, keeping in mind we have different planes of movement as well that shoulder can move into, and everyone is going to have a different normal. And I wanted to give you an easy shoulder screen. Some of you guys might have seen this. It's just the Apley Scratch Test. You don't have to take a measuring tool to it. You can kind of eyeball it because, again, screens are meant to be super quick, easy to do, easy to recheck. So you're looking at shoulder internal and external rotation, and you want to make sure that you do both sides. And you're seeing the distance between those two hands. Sometimes the fist is closed, sometimes it's open, but you're measuring that distance between the two of them.
Whichever one it is, you want to be consistent with it so you don't screw up your measurements.
Yes, you kind of want to standardize it for all the individuals that you're working with. And now here, I wanted you guys to see, I had mentioned briefly core stability. We're going to dive into this a little bit more, but these are before and afters that Corey Kripe out of Fitness Lying Down shows us how we can get improvements by focusing upon the core first instead of just going after that shoulder joint. So here it looks like maybe we need to focus on the shoulder joint and really kind of work on some of those techniques to improve shoulder range of motion. But here he's showing working on that core stability, utilizing a dead bug. So she's only just pulling those handles apart. She's creating that lat engagement, getting that core tension, and she's going through a few repetitions of a dead bug. This is all he had her do. And this is the range of motion that she was able to get by just providing some improved core stability. She got improved shoulder mobility. And we're going to talk about why in a minute.
But I think that's also important to highlight that load is important all the time. People ask us, can I grab a towel and can I grab a band and do the same thing? Load here is actually a teaching tool on how to brace the core to provide that much needed stability.
Here, I'm going to go through an easy thoracic. This is just meant to be an easy thoracic screen. We're going to set up at a wall or a door.
we have a slight bend in the knee because we want the entire spine to be up against the door. So we want head, neck, and the entire spine flat against that door or the wall. Now, if your client's having a difficult time even getting in this position, or their back is arched, or they can't get it flat against the door, then we already know we have some issues and you've already failed that screw. But we want to bring both arms up overhead, and they should reach the door behind you without having to arch your back. So again, we want that entire spine up against the door, and we want to bring those shoulders into flexion, and they want to touch the door. You'll find if people have limitations, their arms will get stuck out here, or they'll start to move through their lumbar spine to try to get that motion. This is just meant to be an easy way to check to see if we might have a thoracic mobility or a stability issue.
So we checked hip, shoulder, thoracic spine. Now we're going to look at the cervical spine and the lumbar spine. Again, I really wanted to give you guys just easy, quick screens that you can do with your clients. And I'm going to go through the cervical screen here. You're just asking that individual to go through the ranges of motion of cervical rotation, have them go side to side. You're asking to see if there's any complaints of pain, discomfort. Does it take a lot of effort? This one, lateral side bending, you're going to see people kind of compensate if they've got issues. They might like to pick up their shoulder to their ear. So these are the things that you kind of want to look for. We're going into extension and flexion. And again, to standardize it, you can just go feet together, and you're just looking at that simple range of motion of the cervical spine. Here, we're going to look at lumbar flexion. I'm going to go through these 3 times, and you're just looking to see the ease of the movement. Can you get those fingertips to the toes? Are they kind of stuck halfway? Do they have pain or discomfort? Oftentimes, people with chronic low back pain, this will elicit some pain and discomfort. I'm going to go into extension here. This is my problematic area. You can see I don't have hardly any lumbar extension really going on. I have some structural changes occurring that just doesn't allow me to get into extension, and it actually is uncomfortable and causes a lot of pain to go into extension. But you can tell it's not that great. Going into rotation as well, looking to see same side to side. Again, it's when we start to see those asymmetries when it's going to set us up for dysfunctional movements and difficulty performing certain exercises. So this is something you can check and recheck after you go through some of your warm-ups or some of your mobility and stability drills to see if you've got an improvement in these areas.
So a great example of someone who struggles with some of this is myself, because probably over half of my spine's fused at this point, and almost my entire lumbar region is fused. So if you look, when I initially do the spinal flexion test, as Jessica described, I have a lot of guarding that goes on. All right, so it doesn't take me too long to feel some nerve tension. I also have some nerve damage from the disease. So again, that's where I get to. But you can see if I practice a few drills to relax my nervous system, to calm my body down, to let my body know it's safe, I can access greater range of motion. Now, you'll see that I don't get the curve that Jessica was getting in my lumbar spine that you should see in people because I'm fused. So those segments actually cannot move. So I access it through greater hamstring and thoracic motion. But again, just showing you more so, initially, if you looked at me, you would say, Josh needs mobility training, and if you attack my joints, that's going to be a problem for me. But if you attack the guarding and the protective mechanisms that are causing me to have restricted mobility, then I can access greater range of motion and have better movement. And then the last thing we want to go over is just kind of the ankle joint as well. So again, what we see, we did a whole presentation on heel elevated squats and why that's not great for ankle mobility and foot stability. Again, if you're not measuring it, we don't even know if it's an issue. So again, we need to know if we're measuring it. But as far as improving it goes too, this currently mentioned having that core stability, but also not just core stability. In the case of the ankle, if we get foot stability, we'll also get better ankle mobility. We'll go over that out in a minute. But here you can see Jessica going a couple of different, the top left, she's doing a higher level version. The super band is giving her some feedback, getting some gentle ankle distraction, but more so making her foot create stability while she's moving through the range of motion. She's creating tension on that ultimate sandbag overhead, getting some thoracic rotation too to accentuate that movement. Now, if she couldn't go overhead, she can go that front load position that you see in the middle picture, where you see her again, if we go here, that she's using a half full roller. So she's getting a little dynamic stretch in the calf, but she's also needing to create foot stability as she goes down, that core stability and moving through the hip. So we have a foot stability, ankle mobility, hip mobility, core stability exercise all at once. So a pretty effective way. And then in the top right, you can see she's doing more of what we call a nerve glide. So a lot of times if you feel extreme burning or type of tension in something like the hamstring when you go into a stretch, that could be more nerve related. You do need to be careful because you don't want to over challenge that area because the nerves can be entrapped. But you can do a gentle nerve glide where, again, we're using these concepts to access better ranges of motion. So a couple of the keys that we want to go over as far as myths go. So one is that we should move like we did when we were kids. Well, it's a nice romantic idea, but it doesn't play out to be factually very relevant. For one, children's bones, infants' bones are more pliable. They're able to flex more than adult bones do. So we don't even have the same type of density to our bones. Kids are actually born with less bones in their, or more bones in their body, than a normal adult, because eventually some of those bones are going to fuse and actually become different types of structures overall. So again, we're talking about a different scenario overall. Kids' ligaments are stronger than their bones, which is not true of adults. Children heal faster than adults and can remodel or reshape their bones. And my favorite is that in infants, their head weighs about 25% of their total body weight. So if you apply that to a 200-pound adult, that would be a 50-pound head. That is I know we got some smart people around here, but that is a massive noggin going on. So it's just a false comparison. It's a nice romantic idea, but doesn't hold true to any actual structural comparisons that we can make. Plus, we have to acknowledge the fact that adults, as we age, we do, have certain traumas that occur that do alter the structure and our nervous system along the way. The one, of course, related to that is, do you have to crawl? The crawling in neurological development. If you actually look the work of anthropologists, they don't think crawling is a really big deal, especially when you look at primitive cultures, especially those that are isolated from current society. They often find crawling is not very common. It's both a condition of concerns about being unsanitary, dangerous as far as other animals go, and oftentimes mothers are busy, so they can't just sit there and watch their kids. They have to carry them with them. So the idea that if you don't crawl, that you're going to be somehow neurologically impaired in your function is just not accurate when you look at human evolution over the century. And, you can see that it's also just a cultural thing. There's a great article that sort of pointed out that probably crawling became popular when wood floors and rugs did, because that is when things could be more sanitary, they could be safer, moms can leave their kids without concern for what happened to them. So again, there's many, many different cultures where kids don't crawl very much, if at all, because of some of these issues. So crawling is an exercise, cool, love it, great exercise. As far as need to do it to change your mobility drastically because of somehow you're neurologically impaired in your development, probably not the case. And could crawling help some people's mobility? Probably, but probably more so from the idea of core stability, as we've already been alluding to. So the thing about it's just about the joint. I think we've been already hammering this a bit. Like a lot of times people, when they talk about joint mobility, I think they assume it's just about the joint. And that's not the case. So we've already put out some other issues to concern yourself with. So I thought this video was a really good way of explaining, especially a big issue that people neglect, which is how our other connective tissues can play a role in our mobility. So I'll play this just for a moment so you guys have a better concept of other issues just besides the joint, because oftentimes we probably can't even get to the joint when we're doing a lot of our mobility exercise what we're actually doing and working.
We all know how important it is to move our bodies.
Circle those hips.
But every time I Googled why it's important to take your body through its full range of motion and stretch every day, I got a different answer. And none were convincing enough to get me to stretch. That is until now. As it turns out, if we don't move, we in some ways lose our ability to. Why? One word, fascia. When we think of stretching, we often first consider our muscles. But as we'll see in this video, many of the benefits of stretching are actually seen in our fascia. Fascia is the connective tissue threaded through every inch of our bodies. When your fascia is healthy, it's flexible, rubbery, and elastic, allowing for fluid, graceful movement and full range of motion. But when it's unhealthy, it can get sticky, thick, and literally becomes matted together. Meanwhile, your body feels tight, sore, and your ability to move is restricted, maybe even permanently. Truly, every single time I Googled why it's important to stretch, I got a different and unsatisfactory answer.
But then I watched 3 documentaries on fascia, one of which was $32 American. And now I am convinced. So I'm excited.
So we're going to save you guys some of that investment, but just get the idea that fascia is important. If I can get to the next slide here. Because again, like I said, if you understand fascia encapsulates so much of our body, internal organs, it goes into deep structure of our body. It's superficial too, right underneath the skin. So if you see a dissection like you do on the right here, there's already fascia that's been pulled off of the cadaver. And then when you see all the white stuff, that's fascia. So oftentimes when we're actually moving in these joint mobility drills, we're probably training the fascia more than we are the specific joint itself, because we got all this connective tissue that surrounds the area. So fascia, if you were to see it over a muscle, for example, it would look like this. So this explains how one muscle or one area of your body is connected and related to another. So a lot of times when your clients haven't been very active and they feel tight, they feel stiff, and you're like, why you don't do anything, is because the structure of their connective tissue is actually changing. And so again, by actually moving and doing it more mobility type of exercises, we can actually break that up and get them more of a healthy connective tissue, which will help the body move overall and will gain better mobility. So I almost, when I say joint mobility, I'm just talking about the ability to access those ranges of motion that we've been discussing, and not necessarily what the joint itself is. And to sort of prove this point, there's really interesting research when you look up remote myofascial release. What that means is when you do a myofascial release in a different area of the body than the one that gets impacted. For example, in this study, they found actually working a myofascial release underneath the foot gave the same type of hamstring flexibility improvements as stretching the hamstring itself did. So if you didn't understand myofascial components, you wouldn't understand how that would be even possible. But when we look, and you look at the work of people like Thomas Myers here, the foot has a direct relationship to a lot of structures of our body, our knees, our hips, our low backs, even up into our shoulders. So it makes sense that we have to understand when we do a lot of these joint mobility exercises, we want to make them more integrated, because one area of the body is going to communicate to another. So if we sit there and just try to isolate areas of our body and try to work on very specific joint mobilizations, we're going to be missing the bigger picture and ability to create better solutions. So if you think this is a new idea, it's not really. Even Thomas Myers himself does credit Chinese, traditional Chinese medicine and meridian systems in influencing a lot of the work of fascia lines. And so I thought I'd highlight this. This is a Tai Chi instructor that, they talk a lot about energy and how energy travels through the body. She doesn't know myofascial systems, but she knows traditional Chinese medicine. Listen to how she describes how energy flows through the body and how that matches spiral, or the spiral line and fascial lines overall.
Down the outs of the backs of the arms, and then it comes around somewhere in the back of the head, at which point it actually crosses. Okay. It crosses and it goes down the legs on the opposite side that it started on the head. So there's a cross for the energy down.
So she's not even talking about fascial lines, but she is talking about fascial lines. So these aren't new concepts. They're new concepts to a lot of people in the fitness industry, and the way we're looking at them now is a bit different. But these are relatively old. I've even seen a friend of mine post about high massage, strategies, and they use the same concepts in how they address the body. So it makes sense. Why would we sit there if we have a shoulder mobility issue and just crank on the shoulder and not look at the entire chain that is integrated with that shoulder? So a great example of this is when we think about hip mobility. So we often think that people with low back pain need more hip mobility. That can be true, because if you do look at most people with low back pain, they tend to have reduced hip mobility. We'll get into why in a moment, but that you'll tend to find that is very much the case. But what this research found is that hip mobility by itself is not as effective until you add core stabilization to it. When you combine core stabilization and hip mobility, then you not only get improved hip mobility, but you get increased or decreased pain. You also get increased quality of life. You get a lot higher effect than if you just focus on the hip itself. So we have to ask ourselves, is it a chicken and the egg? is the back pain from lack of hip mobility, or did back pain cause hip mobility issues, as you guys will see? So that comes into the joint by joint approach that we've talked about from Greg Cook and Mike Boyle numerous times, but I need to hammer it because there's those wonderful contrarians out on the internet that love to say this isn't accurate. But if you look at the research, it's a lot more accurate than people give it credit for. And it's meant to be a generalized concept to think about the body. So joints have a dominance towards stability and mobility. So if those feet aren't creating stability, the next joint upper of the ankles are going to try to create that stability via tightness. Same thing if we look at the lumbar spine, that core area, right? If they're not getting stability from the low back, then the nervous system will go, and want to create safety. And in order to do that, it's going to create tightness. Most of the time, you're going to see that in the joints up above and below, meaning the hips and the thoracic spine. So if you're chasing thoracic spine mobility, but you're not adding in core stabilization into those drills, you're not going to get the long-term desired effect. So examples like Greg's showing here, where we're creating that proximal stability, he's creating that tension, and we're doing this in different forms while moving through different hip mobility drills and range of motion. Like here, he's bracing a little bit harder, actively pulling apart the USB. This would be better forms of creating hip mobility, but we're also getting that lumbar stability at the same time. We can even add in super bands to get a little bit more feedback to the body. But the tools are provide feedback to teach the body how to create proper stability when we go in these ranges of motion, and they're going to create longer and more profound effect. So again, Coach Adama here is going to show we have an extra large mini band around the feet to get the feet to create stability, because then we'll get ankle mobility, which will also help our hips. He's got a super band around his hip to create a little traction, also feedback to the hip to extend the hips. And then he's going to create a little bracing through the core, right? So again, this looks complicated, but it's not really. He's got a band around his feet, one around his hip, and he's pressing out an ultimate sandbag. How complicated really is that? It's only complicated if you don't know why we are doing it. So we can only hold so much load out here. So if someone had a shoulder problem or we want more load, we can go to that front load position. We could create that bracing is actively pulling apart the USB, going into the motion. So a progression. And then we could add a little, see if I can make sure everyone sees this, thoracic spine movement. So now we're getting hip mobility, we're getting ankle mobility, we're getting thoracic mobility all at the same time. But you can see 3 levels of progression to get there, so we don't overwhelm the client in those progressions.
Now, Josh has really already talked about ankle mobility and foot stability, but I just really want to reiterate the importance of the feet. Like Gary Gray, physical therapist, says when the foot hits the ground, everything changes. So if we lack foot stability, then we could possibly have ankle mobility issues, and then it affects the entire chain. So a foot problem can affect the hip, it can affect the low back, and I'm sure you've seen it before. So we really do need to focus on the feet when we're talking about mobility and stability. And this is a way that you can easily get people to start learning how to create stability at the foot. Josh has already mentioned the use of mini bands, but this is around both feet. You're asking that person to grip the ground with their feet. On the left, you can see Josh trying to pull my big toe up, and he's just checking to make sure that I'm creating that stability. This is super easy to do with your clients. You can get them out of their shoes. And once you start teaching them how to improve that foot stability, you're going to notice it in the entire chain. And then again, why are we focused so much on the core? It really is the foundation for movement. We've talked about this, I think, through the past 4 webinars now, the importance of the core. And I'm not talking about the transverse abdominis. I'm not just talking about the obliques. I'm talking about the entire core musculature, the greater than 30 plus muscles of the trunk and the pelvis. This is the foundation for all movement to occur. So if we just focus upon one singular joint and try to get improved mobility or try to get improved strength of that joint, we're missing the bigger picture, and you're going to miss out on having better improvement overall. So we really do need to make sure that we have that core stability and teach that core stability and have a solid foundation for movement to occur. And this is just one of many, many studies looking at core stability programs. And this was a 6-week core stabilization program that improved hip mobility. So they were just really focused on core stability exercises, and they saw it affect hip mobility quite impactfully. And this isn't, like I said, this is only one of many. There's other studies looking at people with the osteoarthritis of the knee and performing just core stabilization programs, and they had improvement in functional scores. They had decreased pain. They had improved gait. So really, leaving out that core is going to cause more problems.
There's even an interesting study showing using core stability to improve things like frozen shoulder. So again, that's how impactful it is. So what does that look like in your training though? So for, let's say, taking a squat, how many times, say, if you guys taking a new client, ask them to do a bodyweight squat, and it just looks like, oh my God, this is going to be a long day, right? Like they're pressing forward, they can't control the knee position, and so forth. The reality is people just don't know how to move their bodies through space. So they need a lot of feedback, especially early on. So if you ever had someone do a bodyweight squat and it looks like a hot mess, but then you ask them, let's say, gently hold on to a squat rack, and the squat looks pretty decent, that means it's neurological, right? Their body just doesn't know how to control their body through space. So what Jessica's doing here, she's got band around her feet. So if the lifter feels like the tension of the band decreases, we know the feet are caving in. So we know we're already losing that stability from the ground up. So the band gives us feedback to the feet. She's got the band around the knees because she's going to want to actively push out the knees to actually activate a lot of those pelvic muscles, especially the glutes. Then she's going to work the core from the top down by going into that press out. So Jess has good mobility, but her mobility is actually even better when she does this press out squat. So she's active throughout the entire body. A good squat should be almost a full body exercise. So it's not just about having a bunch of tools on your body. It's about understanding what the tools are doing and how to use them to your benefit. Because it's not going to be something like just dropping down and doing a press out. It's being very deliberate in what you're cueing and how you're using these tools, provide feedback to the body to understand how to create those appropriate systems of stability. Because not just about grabbing a weight in any form, right? 2 out of these 4 drills, a dumbbell and a medicine ball, are actually pushing in. And when you push in, you get the pecs, you get more rectus abdominis. You're going opposite of what we want to create. Then the kettlebell is too narrow. It's not pliable. You can't pull apart. I'm bringing this up because inevitably we're going to get this question probably today. What else can I use than the tools that you guys are showing me? We're showing you these tools because they work the best. Just as an example, you get really fast results with this. So if you're talking in a clinical setting here on the left, in Dr. Craig Liebenson's office, how fast you can transform squats, or when we worked with military and tactical athletes that have a history of knee problems, they haven't been able to squat or do their training because of their knee pain, they can all of a sudden move without pain. These results are pretty profound if you use the right strategies with them. And the same thing goes with just understanding how different concepts play into it, right? So a lot of us believe that, or we've been told to use body weight first. Body weight is probably the most advanced form of movement because you have no feedback of how to control your body. Load instantly gives us feedback and allows us to create some stability. So if I have body weight, my body already needs to know how to do that. My nervous system has to feel confident doing that. That's why a lot of times you'll see a body weight squat like the top right. And then unfortunately, then people go, that doesn't look good. Let me give you a goblet squat. They give people too light of a kettlebell. Let's say this gentleman couldn't hold enough weight and doesn't really fix it. Versus using, let's say, a bear hug squat position where we can have more load. We can make the weight part of our body. That load and feedback allows us to get a good squat. This was not scripted. This was actually a coach working through these progressions to find the right one for their client. But goblet squats are great, but again, using the tool correctly is important. I'd rather say calling a goblet squat, call it a kettlebell goblet squat, because the kettlebell is the best tool for it if you use the kettlebell correctly. Holding the ball of the kettlebell, you're not getting that stability that we want by creating tension against those handles. If you allow the elbows to flare, you're losing tension and stability. You're not getting the benefit of the drill. Dumbbells are okay, but again, you're opening up, you're losing tension to the core and the lats, which are an integral part of how we create that stability that makes the goblet squat so effective. So you need to know how to use your tools. Jessica will be the first to tell you, I am not a handy guy. You can give me the best tools from Home Depot in the world, I will just make a mess. But if you give a carpenter a couple of tools that they know how to use really well, they can make beautiful things. And the same thing goes with our training. So how important is a lot of this stuff? Very. And I want to give you guys a really extreme example. So this was a study done on people that actually had a chest surgery. They actually opened up the chest cavity to address a specific issue. Afterwards, they wanted to regain that chest mobility. So what they did is they compared chest mobility exercises without core stability and chest mobility exercise with core stability. And they found, as you guys are probably guessing, the one with core stability did much better. So this is, even in the most extreme examples, something we need to integrate with the body, especially if people have overcome an injury at some point in their lives. So what does that look like? Especially in that state, P&F patterns, we talked a lot about that in our shoulder mobility course. A lot of these diagonal patterns, we can work from half kneeling. So again, a great way to work on hip mobility, shoulder mobility, or stability. We can work into a supine position like a dead bug here, like Shannon is doing. Again, working on that core stability. This is also good for hip mobility and shoulder mobility and stability as well. And we get more dynamic strength and performance training like Joel's showing through that Bulgarian split squat, lift, and chop. So again, what muscle does this work? A lot of them. And that's why we have to understand chains instead of trying to isolate so many individual components of the body. And there's, again, just to mention, so much research behind all this. It's very frustrating for us to watch coaches completely neglect and ignore these concepts when they're showing joint mobility exercises on social media, because they're not adhering to so much of the literature that's out there. So this study actually looked at core stability and myofascial stretching as ways of creating hip mobility, and they found that basically combining myofascial stretching and core stability produced the best results in hip mobility. So again, we went over core stability a little bit, but myofascial stretching is more integrating the extremities and these different diagonal patterns. So again, you're seeing this play out again, even when we're talking about myofascial work, we're talking about fascial connective tissue and the joint being more integrated. So what does that look like? Well, we showed last time Jessica doing one with a suspension trainer here. This is a myofascial stretch. We're creating tension against the handles and the feet to create that stability in the core. That'll open up our thoracic spine, our shoulders, and our hips all at once. We can use drills like this where I am controlling my body through space. I'm using spiral patterns with specific breath work. So I'm using those diagonal and rotational patterns. This is a ankle mobility, hip mobility, shoulder stability, core stability exercise all in one. Again, we can use different levels of stability and challenge. So again, more dynamic, using breath work, teaching people how to use their feet, coordinating the rest of the body, being more synchronized, being more specific as far as creating better movement, not just individual muscles. So again, what I want you guys to keep in mind is how many areas we're attacking at once. And this is coming from someone who has a very severe spinal disease that, like I said, half my spine is fused, yet I can teach my body to access much more mobility than someone else like that would have my issue probably would never be able to do. And so again, we're hammering on this because there's so much research too that just passively increasing range of motion of a joint doesn't transfer to functional movements very well either. So again, one of the reasons we're hammering these things with the science is because this isn't our opinion. This is study after study after study. We're not cherry picking one or two studies. This is study after study. This is the plethora of studies showing these effects. So again, at the end of the day, hopefully now you're starting to see this is a mobility exercise and a stability exercise. This is a mobility exercise and a stability exercise. This is a mobility exercise and a stability exercise. So we're having them all happen at once. But if you didn't understand these concepts, you probably wouldn't think of these as mobility exercises. This one's not only a shoulder and thoracic mobility, it's a hip mobility exercise. And it should make more sense why now. So another one is that posture doesn't matter. How often do we hear that?
Okay.
And I'll be the first to say, there is no one posture, but there are definitely better postures. And unfortunately, this myth gives rise to there are no bad movements, just ones you're not prepared for. This is the worst advice going around the fitness industry today. This is horrific. Number one, it completely devalues you. Because number one, if there are no bad movements, then I don't need you, right? As a trainer and coach, why do I need to learn how to do something? There's no bad movement. But let's get into it a little bit more scientifically. So a lot of people misunderstand what's happening because everyone likes to use the example of a powerlifter, right? A powerlifter rounds their backs and they don't get hurt and they can do it. Well, number one, they sometimes don't get hurt. We'll get into that in a second. Two, the rounding usually comes from the upper back. Three, they're creating pressurization in their spine. But McGill even talks about a case where there was a 2 to 3 degree change in a lack of stability in a powerlifter's spine during a heavy lift, and they literally broke their backs. 2 to 3 degrees. So the question I like to ask a lot of coaches is, are you training elite powerlifters? And even if you are, there's some things we should consider. But that's not a good reason to say there's no such thing as bad movements. That's pretty lousy. because there's a wonderful study out there that looked at 104 sub-elite powerlifters. That's a good number. They asked them a questionnaire. They found 73% of these powerlifters were currently injured. 73. If I had 73% of my clients currently injured, I'd be out of business more than likely, if not sued one way or the other. And 87% had been experienced an injury within the past 12 months. So do we really want to be using powerlifters as an example of health? I have nothing against the sport. It is a sport. And in a lot of sports, injuries do happen. But don't use this excuse to not understand how to teach proper movement. Because there is something known as joint centration. That's basically the idea that our joints operate in optimal rate positions and pops, right? There's not an exact one, but there's a range where they perform their best. For example, this gentleman here, if you look at him, in the first picture, it looks like he's got reduced external rotation of his shoulder. And the second picture looks like it's much improved. Now, if you watch, though, look at his chest and his core. In the first picture, he's kind of sunk. So let's all do this together. Sink your chest, slouch down, raise your right arm up, and see how much external rotation you can get. Now, just simply try to sit upwards and see, does your external rotation improve? Unless there's something dramatically wrong with your shoulder, the answer should be yes. This is an example of joint centration. But if you follow the idea that there's no such thing as a bad movement, so when I'm sunk here and my shoulder's compromised, I go to overhead press, that is going to at some point damage my shoulder. It's a question of when, not if. That is why we need to understand concepts better. So this was a tough one. Jessica, I really struggled with this one. Everyone now is praying tightness or strength issue, right? Am I getting that right?
If something's tight, you need to strengthen.
And I don't know where that came from. We went through this science as much as we could. We went after journal after journal, every platform we could find. We couldn't find any evidence of this, could we?
There is nothing else.
But this will still be prevalent on social media here. I think my best guess is what happens is there's a misinterpretation of Dr. Vladimir Yanda's approach from the late 1980s. I learned about this in the 1990s. Some of you may know this. Upper and lower cross syndrome. So it used to be when we had a collapsed chest, the pecs would be short and tight and considered strong. And let's say your rhomboids would be long and weak. But what we found out, that model really wasn't accurate. You could be short and weak, and you could be long and strong too, right? We didn't really model very well. So we think that it might be some misinterpretation there of the science. And especially if people look at science like this, and basically what this study did is they found in a well-pound organized strength training program, flexibility improved. But I think people are misunderstanding. It wasn't because muscles were weak, but because they gave stability to the body, right? So when people actually used whole body lifts and gained better stability, makes sense, they gain better mobility. So it doesn't mean if your hip flexor is tight, start training your hip flexor. That's a really weird thing, is it not, Jess?
It's trending. All right, myth number 4, just create tension. I think oftentimes this is becoming really popular as well. If you just create all this tension and then you start moving that joint, you're going to improve joint mobility. And that's really not the case, because we've already went through reason after reason after reason that if you just try to push that joint through the range of motion, you're not going to see a whole lot of improvement. And we have to understand the law of irradiation. So if we're creating muscle tension at one area, it's going to recruit the surrounding areas as well. But position matters, that we've been talking about this whole entire time. So if you go ahead and hold your arm out and really create a fist, have that fist and that palm facing upwards, you're going to feel the tension throughout the entire upper extremity down into the trunk. But if you turn that fist over and go palm down, you're not going to create as much tension. So position matters, and understanding why we're talking about tension and why we can recruit other muscle groups as well when we're creating that. But we're back to that proximal stability as well. And we've been talking about it over and over and over again. We want that proximal stability to create that distal mobility. And I'm going to give you guys an example. I'm working with a young woman. She has a progressive form of MS. Her only goal is to be able to move her arm and hand enough so she can maneuver her electric scooter. She can't do that at this point. So our focus, I start off creating that proximal stability. So we'll work on sitting balance. She can't really sit unsupported, but we'll work on creating that proximal stability. we'll really zero in on that core stability, that proximal stability as much as we can. And I can tell you after the session, she is able to start moving her arm, her shoulder, her hand. She starts to be able to recruit those distal extremities much better. So I think that's a good example of what we're talking about with proximal stability for distal mobility. And understanding Josh and I are really trying to make this easier for everyone. Really, if we focus at the core, we'll see improvement throughout the body. And again, this is why that joint by joint concept is so important. We want to have stability where we need stability. That'll provide mobility at the areas that need mobility.
So again, like just I said, it's not just creating tension. And listen, I love medicine balls, but I love medicine balls for medicine ball throws mostly, and some other drills. But you can see if I try to create tension just by pulling apart, I'm having my elbows come away from my body. I'm losing my lats. I'm losing that core stability that I want versus, let's say, as Robin showing a bear hug position, or if I use a goblet position, my elbows can stay close to my body and create that proximal stability, and I get the effect that I actually want. So a lot of times people are just not doing what they think they're doing when they're using just random tools and just doing random concepts. Here's me giving a little breakdown of this exactly. So a big misunderstanding people have about creating proximal stability for distal mobility, in other words, getting core stability for better hip mobility or thoracic mobility, is just creating tension with anything doesn't work, right? I know I'm creating tension, but I can't really engage my core correctly because my arms are away from my body, taking away from the lats are a big core stabilizer. Versus, and this is why using the right tool matters, if we use our ultimate sandbag here and create that tension, now this is so much easier for me to create that core stability because my lats are engaged because I'm in a dynamic plank, creating tension against the back. My elbows are close into my body. That's why understanding why you're using different tools makes all the difference. And so again, that's why, again, the reason that we can get an effect that other people can't get oftentimes is because we're just watching the details of the movement more closely. So here's one more example for you guys. We'll start wrapping this up. So a lot of times you'll see people doing a hip mobility exercise that looks like this. Now, just because it's holding on a couple of dowel rods, now there's this tension, but she's not getting much core stability. She's getting more artificial stability, meaning she's able to balance off of the post. But because the post and the position just can't give her that proximal stability, what would be better is if she took a suspension trainer where she can still have that counterbalance, but now she can drive downwards. Now she can access that proximal stability a lot easier. She creates that tightness, that bracing through the core as she goes through that range of motion. The goal would be over time not to need that artificial support, but we can still use core stability as she could use that front hold position to do the same thing. So this would be our progression on that mobility because I want her to be able to control that range of motion without the support of an external system. And that's why the highest form would actually be doing body weight because now she's got no feedback. So she's got to be able on her own to create that proximal stability and that motor control that's going to allow her to be successful. This is probably the opposite of how most people think about progressing mobility. So how do you know if what you're doing is working? Jessica gave them a whole bunch of screens that are very easy to use. I steal this from a chiropractor friend of mine who used to adjust me and asked me to walk around the table for 30 seconds to a minute to see if the adjustment stuck. If it didn't stick, then we weren't on the right track. That you guys can basically do the same thing, is retest your clients, whether it is later in that session or, have them get up and walk around for a little bit, see, does their mobility hold? Or weeks down the line, give them a few weeks to adapt and see, does that mobility start to hold longer than when you originally screened them? And also build value in what you're offering your clients. You go back to your client and say, you started here, but look, now you're here. That's an improvement that builds value in your service. So what's going to cause the biggest improvements in mobility? I think hopefully we got through it. Improved stability, which is greater motor control, how you control your body through space, better balance of the muscle groups and the kinetic chains, and increased connective tissue elasticity. So again, we're not just talking about the individual joint, but all the systems that integrate, including what that nervous system is going to do. So we're going to open up for questions in a moment. We just launched this week a really cool 4-week myofascial integrated movement class, which is going to go over how we do teach the science and bring science to life into constructive programs, cueing and coaching, a lot of these different drills. So if you're interested in that, you can email us at info@ultimatesandbagtrain.com. you can go to our website, dvrtfitness.com. And if you email us, it'll get to the right place. We do have tons of courses, online courses that involve mobility. If you have questions, feel free to email us. Jessica's got some wonderful courses on knees, shoulders, low backs, and even gait. You can use code PB30 to save 30% on any downloadable online programs that we have. So with all that said, I think we'll turn over to some questions now. So let me just leave this up for a moment. All right, let me take off the share and we'll get some questions shared. Where can we learn more in depth about mobility and how to get our clients to have better range of motion? Is there a course that you offer? I love this and need it slowed way down. Well, yes, we realize that an hour is a very short time, and we even went a little bit over to address a lot of these in detail. So we appreciate your guys' patience. Yes, if we do have a lot of different courses, you guys can email us if you want help direction, figuring out which ones are appropriate for you. You can go to dvrtfitness.com or email us at info@ultimatesandbagtraining.com as well. We can definitely help you guys out with that. One can say, so does the nervous system, and train the nervous system to adapt, I feel, as a contributor. Yes, the nervous system is probably one of the main factors in a lot of people. There's even really cool evidence now showing that long-term sitting causes actually fatigue of the deep stabilizers muscles, and that alteration of the nervous system, experiencing that fatigue, is what causes tightness when you get up from sitting for a long period of time.
Can the client hug a foam roller if that's all you have? We talked about the importance of load. So load is going to provide a lot of that bracing, or that ability to brace and provide a lot of that core stability. So a foam roller is not going to give you that. Plus, it's rather narrow. You're not going to get really a good...
You can't create that tension very well.
It's just not going to be able to create that tension. What do you recommend for hip flexor issues rather than doing what is currently being demonstrated on social media? So again, that's kind of that thing, what you see on social media for hip flexors, people think they're tight, so then they're showing a lot of strengthening and a lot of stretching. Hip flexors react really well to core stability.
They're like core stabilizers.
Yeah. They are technically core stabilizers. So if we focus on core stability, you're going to find that those hip flexors kind of automatically relax, and they're going to be less tight. Also, working on a lot of motor control is going to be very beneficial for that hip flexor tightness that people tend to have, because you don't really see a lot of results when you just stretch those hip flexors all day, every day, and do, trigger point stuff. That's why it's not working. It's because we really need to focus on the core.
And you don't want to just isolate the hip flexor either in strengthening, because again, understanding, you have to ask the question, why is this tight? Why do you think you're seeing this tightness? It could be a foot issue. It could be an ankle mobility issue. It could be a core stabilization issue. It could be a glute issue. So that's why you want to take a more integrated approach. A lot of the drills that we were showing would definitely be appropriate hip flexors, taking it through range of motion as you're teaching foot stability and you're teaching core bracing is going to be probably the best way to go about it.
Is there anything as too much feedback for someone just learning to perform a movement? I find clients often have trouble grasping, a couple cues. So tools can be great feedback for individuals. You don't have to cue a whole lot. You can hand them that tool specifically, if you say, hey, hold this ultimate sandbag, really just pull in. That's really all you have to cue. They create that tension, they create that bracing automatically, but tools can be an amazing feedback. So you don't have to do so many verbal or tactile cueing. We showed the mini bands to create that foot stability, simple cues, grip the ground with your feet, pull the bag in. That's 2 cues. So using tools is going to be really beneficial.
Yeah, so you almost want to think about using tools as like an assistant code. So again, if you're not using complex terminology like Jessica's saying, we're like putting the cripsy arm and saying, pull the bag apart. We're saying, don't let the band lose tension on your feet. Push your knees out against the band, stretch the band with your knees as you go out in the squat. So no, I don't almost ever find it too much. Now, will they get everything right first? Probably not. But will they be far better off than they were? Probably. So again, as they focus on 1 or 2 cues at a time is the most efficient way of doing it. And once they do 1 or 2 things well, you can move on to other cues as well. But again, as soon as they feel a little bit better, they feel a little bit looser. Again, I almost use my Jedi mind tricks with people, because if you go, how'd that feel? People don't know the right answer. So they'll be like, good. They're not really sure what you're looking for, but you go, Do you feel like your hips are a little bit lighter? Does it feel a little easier to squat? They might be like, yeah, I do feel a little lighter, a little easier to squat. So no, remember, tools are meant to help you reduce the amount of verbal communication you're giving to the client. If you don't use tools, you actually have to say more things, right? That don't make sense to your client because they don't know what it feels like. Jess, do you provide any online consultations?
Yeah. Feel free to email me. There's some questions on consultations and things like that. So my email is up there. Feel free to reach out and I can send you the information for that.
If you're not sure, it's jessica@ultimatesandbagtrain.com. As far as the weight of the ultimate sandbag, we would recommend in a lot of these drills. If you're using the front load position, so the crooks of the arms, probably about 25 pounds is good for most people. You can go 28 pounds. If you're talking some of those lift and chop patterns, I'd probably start with around 10 pounds. That's much more challenging for people. This would really help me on this issue. Most of my clients have back knees. One of them has a fused spine. Oh, great. We love to hear that. This is going to be useful. That's the whole goal here. Ever use foam roller? Yeah, I mean, foam roller can help with some of that myofascial tightness, but I would look to see, does it help? Right? So, are you using any type of screen to see, is it helping the problem? Meaning, are they getting fair range of motion? If they're not, then you have to start questioning it. Are they having a reduction in tightness or a perception of tightness? So that's valuable, right? People start boo-hoo some of the subjective stuff, but if someone feels reduced pain or tightness, then definitely use it. Use it at the very beginning or use it as homework for them during their day. It's anything that they can do easily on their own. I try to get them to learn to do that in their off time. And so we can maximize the time with us as times where they get to access my coaching because there's not much coaching I need to use once I teach you how to use a foam roller. Thank you guys so much. Do you recommend a standardized assessments as each coach's clinical eye is different? I mean, FMS has a really good system.
FMS is heavily backed by research. They have a whole system for screens. If you're a clinician, I would recommend their SFMA for their assessments. It's already put together and out there and a lot of information on it.
So I think we hit everybody. So next month too, we're going to hit on glutes. We're going to talk about the glute shrews. The dogs are getting towards their dinner time, so we'll keep this short. But I want to say thank you guys for Jessica and myself for spending the time. Hopefully this got you excited to learn more about it. And we'll maybe even do a month 2 of mobility myths, and we can expand on some of these ideas, give you guys some more examples as well. Email Chris and Aaron if you have questions, and we'll have the videos available to you on their app. And you guys can definitely reach out if you have any questions.